Hi, my name is Charlotte Gillis.
And I'm Sarah Fisher.
Okay, and we're going to have a common theme around fish because we also used a FishBone, and so therefore it connects all aspects. Today we're going to be talking about a graphic organizer and how we used it with one of our articles.
Okay, the first thing that you need to do in getting an article is making sure that it's an original research article. That is our first step in our FishBone organizer. In finding an original research article, it should contain 7 main components, and these include the abstract, the introduction, the background, method section, results section, discussion section, and a conclusion.
Okay, so the abstract is going to be a summary of everything that's included in the article. This is a good thing to read because here you find out if the information is necessary towards answering your clinical question. Then it's going to be followed by your introduction, which of course is going to contain the problem and the purpose statement. Then it'll do a little bit of background, so it's going to do some background on the significant research done for this topic. It's going to also talk about how the information was obtained in the methods section. So here you're going to have your study design, your sample size, and the data collection, like I said, so how it was collected, the type of measures to be used, followed by the results based on your methods. So this can sometimes be difficult to understand, but it basically shows how the data was created for statistical components to find the significance. Then it'll have a discussion section, what they think. Here you're going to interpret your results. You're going to see the implications towards the nursing practice and also the limitations used for the study. Then it'll be followed with a conclusion of everything done in that study.
Okay, the next step in our FishBone design is step number 2, and that's looking at the abstract. We're going to dive into it and discuss what you can find in it. In the abstract, it gives you clues as to what type of design that your study will have, whether it's experimental or non-experimental, and the specifics of each, possibly. In an experimental design, you'll have an independent variable and a dependent variable. The independent variable is the implementation or the intervention, as in nursing terminology, and the dependent variable is what is measuring it. What did we find in our abstract?
Well, we found that this is an experimental study. Our IV, our independent variable, is your rapid response team, and our DV is your mortality rates and your cardiopulmonary arrest rates. It also said in the abstract that this is a prospective cohort design.
Okay. The next thing that you want to look at in your article is the method section. You can find a lot of important information in the method section. What you're looking for, as we discussed earlier, was the data, how it was collected, instruments used, how they broke down that information. It gives you a lot of detail. What do we find in our method section?
Well, our method section described what the rapid response team was and what they were doing to implement it in their hospital. Then it also broke it down into how they were going to be figuring out their information. So they based it off of 1,000 admissions per cardiopulmonary arrest rates and 100 admissions per mortality rate.
Okay, so that brings us to a sub-step of 3, step 3.1, and that was figuring out through the method section what type of study we have. So besides it saying in our article that it's a quasi-experimental study, we also thought about what that kind of study is, and this type of a design has 2 of the 3 components of a randomized control trial. It has an intervention, but it either lacks control or randomization. So how did we figure out what ours was?
Well, we realized that it lacked randomization because we did it based on a convenience sample. Because you can't cause someone to die, you can't kill someone just for a study. So that brings us to it being a convenience sample based on selecting anyone that's going to have this type of situation happen.
Okay, that brings us to the results section, which is normally the hardest part to read and understand because it has a lot of statistics, and we're not very good at that, as evidenced by our last class. But That's where the results are examined to determine if there's significance, and different things that you're looking for include confidence intervals, significant levels, and odds ratios. So what do we see in ours?
So in ours, it had all of that stuff, and the numbers, it's all in the article. But based on that, they drew a lovely diagram for us to see. Over here, this is the before the intervention, and this one over here is after the intervention, so you can tell that it was a positive intervention.
Moving right along, we end with the discussion section. And this provides information, it gives you a summary of what they found, it introduces limitations of the study, and also gives ideas of where the information can be taken with.
Okay, so in this section, we found that there was selection bias, as stated before, and there was also contamination to the control group because of some ICU nurses were used in different settings. And now we're going to talk about how it falls on the evidence hierarchy.
Okay. So ours is a quasi-experimental design. The reason it's quasi is because of things that we said earlier, that it lacks randomization, because we had to use a convenient sample just because that's what most nursing studies use, because it's just not appropriate to randomize the group. Other ways that because it was an experiment, it fell in the middle. But
if we wanted to make it better, we would have had a randomized study, or if we wanted to make it, well, not worse, but fall lower on the reliability, it could be a qualitative study.
And if this were just one part of a large collection of data that had this similar or identical study design, was combined and created by statistics, it would be a meta-analysis, or it could be as a part of a systematic review if it was similar but also had
qualitative information as well.
Yes. So this is why ours falls in the middle, and how other designs would fall above and below.
Okay.
All right. So thank you very much for watching. Bye.
Bye.